Did you ask something there, Tim?
Yeah, are we waiting on Louise and Monica? And
I'm assuming so. Otherwise I'll have to remember.
Good morning to this meeting of the Public Health and Prevention Cabinet Panel. My name is Tim Hutchings. I'm Chairman and Cabinet Member for Public Health and Prevention. Before we start, I have an announcement which I have to read out, which goes as follows. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the panel are asked to keep their microphones switched off until called upon to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish. If you experience connection or other technical issues, it may help to switch your camera off. Cameras should be switched on if and when speaking in the meeting. To indicate a wish to speak, members should use the raise hand function. Use of the meeting chat function is exclusively for voting. At the end of the debate, on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against, or abstain. I will declare the result after each vote. If it's required, after 2 hours, we will have a short break. Obviously, if someone is speaking when that time comes, then they'll be allowed to finish what they were speaking about. Other breaks will be incorporated as appropriate. Today, we have no substitutions, but no apologies. Before moving on, I'm going to invite members of the panel to introduce themselves. So first of all, Annie.
Yes. Sorry. Yes, thank you, Chair. Yes, I'm Annie Brewster and I am Vice Chair of this panel. Thank you.
Thank you. Lynn.
Good morning, everyone. I'm Lynn Chestman and I represent Welwyn Garden City South. Thank you very much.
Thank you, Lynn. Caroline.
Good morning, Chair. My name is Caroline Clapper and I represent Watling Division. Thank you.
Thank you. Margaret. Not here with us.
Hello. I'm Margaret Peterson and I represent Hatfield North.
Thank you. Susie.
Good morning, I'm Susie Gordon. I represent Hatfield East and I'm also Vice Chairman of the County Council.
Thank you. Fiona.
I'm Fiona Guest. I represent Hemel Hempstead North West and I'm a pharmacist in my day job.
Good done. Tina, are you with us? Tina, are you with us? Yeah, Tina's got a health engagement. Will be joining us later, I think. Mark.
Good morning, Chairman. Good morning, everyone. Mark Mills Bishop, representing Conservative member for Flamstead End and Turnford, and a member of this panel. Thank you, Chairman.
Thank you. Nigel.
Yes, good morning, everybody. Nigel Quinton, I represent Hanside in City for the Lib Dems.
Thank you.
City for Lib Dems.
Anthony?
Anthony Rowland, St Albans East. Good morning.
Thank you. Ron?
Thank you. Good morning. Ron Tyndall, representing Hemel Hempstead. Representing Hemel Hempstead.
Your microphone might be causing a bit of an echo. If you wouldn't mind switching off, please. Thank you. And last but not least, William.
William Whitelow, representing Hemel Hempstead Town. Good morning, everybody.
Good morning, a cast of thousands, and very warm welcome to you all. Moving on, I have to remind you that, of the need to disclose pecuniary interests and declarable interest. Does anyone have anything to declare? Thank you very much. Moving on to the minutes of the last meeting, I invite the panel to note those minutes and to simply note them. If you could indicate in the chat panel for or against noting them. Thank you very much. I think we can take that as noted. Moving on, there are no public petitions, so we move straight on to item 3, which is the Hertfordshire Suicide Prevention Strategy. Have we got Louise? Louise, are you presenting this?
I am here, Tim.
Over to you then, thank you.
Thank you. I'm going to apologise now. I'm getting a lot of feedback as I talk, so but we'll see how we get on. So today I ask for your endorsement for the Hertfordshire Suicide Prevention Strategy for 20 to 25. I'm going to just give you a very brief synopsis of the strategy because I'm going to presume the paper has been read. This strategy is a refresh of the 2017 strategy. We have an ambition to have no one in Hertfordshire ever get to a point where they feel suicide is their only option. The strategy highlights a number of priorities, and just to touch on those are to ensure we have support for men, ensure we support those who are bereaved from suicide, assessing training needs of the workforce, support for young people, and reducing access to means of suicide, and to support research and data collection. The strategy, it really brings together knowledge about key groups at higher risk of suicide, the importance of tailoring approaches to improve mental health in those risk groups, and it also really touches on the importance of partnership working. The drivers to the strategy is very much a national steer, so the cross-government suicide prevention work plan and the NHS long-term plan. All of those focus on reducing levels of suicide in high-risk groups. We also have another driver, which is the outcome of the suicide prevention scrutiny we had at the end of last year. That touched on the need for ongoing proactive collaborative working to ensure that we increase awareness of suicide across Hertfordshire and to undertake a review and ensure we have a consistent offer of bereavement services. Lastly, I just want to touch on that the backbone of the development of that strategy is our data intelligence and also stakeholder engagement. So we have done extensive stakeholder engagement through the Suicide Programme Board we have in place, but also the network conference that we held at the beginning of this year. And that's probably enough for me in terms of summarizing this strategy. Welcome to open the floor to questions.
Thank you, Louise. Before I open up to questions, I just wanted to say that I attended the partnership conference. I think it was the beginning of the year. All dates seem to have melded together in the last few months. But I have to say I was extremely impressed by the quality of the partnership, the way it was working and the way everyone was feeding into it. So I think the team needs to be congratulated on that so far. I've got a number of questions coming up. I think William was first.
William actually didn't raise a question.
Oh, your hand's up, William.
Oh, sorry, must have pressed it by mistake.
No problem. Fiona. Are you there? I'll move on.
and correct. I was looking at Microsoft Teams. Yes, but there's a raft of questions here. The first one is the involvement of the voluntary and community sector. Does that include faith groups? And with the work being done with Network Rail, does that involve the rail chaplaincy service? Because I know that if there's a death on the railway line, the railway chaplains do offer their support services to staff who have witnessed it. And this is with the training, the Spot the Signs training. Does that include asking a person deemed to be at risk of suicide if they've thought of taking their own life? Because in my profession as a pharmacist, I've done some suicide prevention training by the Zero Suicide Alliance. And in that training, they said to ask the person if they have thought of taking their own life. They wouldn't put the idea of suicide into their head because they're already thinking about it. But someone with a history of depression did say that that could put the risk or the idea of suicide into the head of a depressed person who hadn't previously thought of it.
Lovely. Thank you. I think I'm assuming I can come in now, Fiona.
Yes.
Yes. So I was just checking. Lovely. First answer to your question was about the access to the faith groups, and I'd just like to let you know that we do have a chaplaincy network which is in operation, and that has been in operation since the start of COVID. So we do have access to all our faith groups through that chaplaincy network. In answer to your second question, with the Spot the Signs, there is not a question whereby they're encouraged to ask if someone is thinking about committing suicide through the Spot the Signs. That question is open in our second stage of training, which is suicide intent training. I don't know at this stage if the Network Rail have had access to that. But that's something I can take away and check. This is a new programme of training that we've offered across Hertfordshire. I think it started about 6 weeks ago, but I need to find out if Rail were involved in that. The Rail Network are a key membership of our Suicide Programme Board, so they are a key player within the programme board. We also have a specific task and finish group which is focused on reducing access to means, and the railways are represented at that. But I just need to do a little bit more work around whether they've accessed that suicide intent training to be able to answer your definitive question. But through Spot the Signs, that question is not promoted.
Okay, thank you. Mark.
You're on mute.
Thank you, Louise. And if you can be helpful, thank you. If you can be helpful, you can come back to all members of the committee by email as to the suicide intent training and who has had it.
Absolutely, I can do that for you. Yeah.
Thank
you.
you.
Mark.
Thank you, Chairman. Thank you, Louise, for your report. It's a kind of confirmation question I have. Are you collecting any data or information since the public health emergency? I know the strategy goes up to 2025, and of course a lot has happened in the last 9-10 months, and I just wondered if you were going to add to the report or an addendum later, or kind of sift through and sort out any additional information that might be helpful going forward with the strategy. Thank you, Chairman.
Thank you.
Yeah, good question, Mark. Thank you for that. No, that's a very good point. We are fully aware, obviously, of the COVID pandemic and the anticipation that could lead to rises in suicide. We don't yet have real-time surveillance to ensure we get that real-time data and informing us whether there's a rise in suicides, but we do have assurance That's through our suicide programme board and through our linkage with the coroner's office and the railways. We are given an insight into whether we have additional suicides in Hertfordshire. So we are collecting that intelligence through those methods. We have an ambition, starting from next year, to move towards the real-time surveillance. Okay, unfortunately, that won't obviously capture the COVID impact. At this stage in time, we are not seeing a rise in suicide rates as a result of the COVID impact. But I would like to stress that I think it's actually too early to say what the ultimate effect of the pandemic will be on suicide rates. There was, interestingly, a paper has been released by the British Medical Journal. I think it was in the last few weeks, and that has already provided us some assurance that the suicide rates have not increased. There is a consistent picture that's emerging from high-income countries, that is, suggesting no rise in suicide rates. But I think I urge that with caution, because I think suicide rates is quite a complex picture. And I think what we potentially are seeing is a rise in the wider factors that could lead to suicide rates. You know, so obviously a rise in poor mental health, a rise in, obviously we're seeing more of an economic recession. So I think it's too early to say. We are fully aware and we are anticipating, you know, keeping a watchful eye, really.
Okay, thank you. Thank you, Louise. Thank you, Chairman.
Thank you. Ron.
Thank you, Chair. Louise, it really, part of it rises from Mark's questions. In the priorities at 2.3 that are recommended, there is nothing covering isolation. And I wondered, is this taken into account in the Just Talk programme, or given, I realise it's perhaps a COVID point more than any other point, but there is certainly instances of increased mental health and other concerns arising from isolation of individuals, and I wondered whether or not any thought would be given to covering that aspect as well. But my other point is quite simply, you've mentioned real-time surveillance. It's also mentioned as a priority in priority 6 on page 34, that we create a real-time suicide surveillance system. I'm not very technical, and grateful if someone could explain what a real-time suicide surveillance system is, please.
Yeah, absolutely, Ron. So the real-time surveillance is a partnership approach to ensuring that we collect the data of any suicides that has happened real time, so that then we can then offer support, bereavement support, obviously to the immediate families. And what will happen is the partnership, if you like, that supports the suicide real-time surveillance will have access to a system to have that intelligence. So that will include the coroners, it will include public health, mental health trust, and I've missed one: coroners, mental health trust, public health, and the police.
Thank you very much, Louise.
That's right.
Isolation point.
That was isolation, wasn't it? So responding to isolation, I think as a public health team, I might have to ask you, Jim, in case you can add any more detail to it. But we have fully recognised, obviously, isolation being an issue during the COVID pandemic, and we have had specific COVID cells. I think it was Operation Sustain, who have been able to come in and provide support to those people that have been obviously at risk of isolation. And we have been working with those individuals to provide them with support in terms of improving their mental health. And that has actually taken the form of providing leaflets outlining what these individuals might be able to do to try and prevent them falling into that isolation hole, if you like. Some of that has been promoting the use of digital technology. Some of that has been advising them on the different types of physical activity they might be able to undertake, be it outside or inside the home.
Thanks very much, Liz.
Jim, did you want to add that?
Did you want me to come in? And I guess the I'm just trying to think where to start and not go on all day. We've done a number of things. So we have a public mental health cell that's done a significant amount of work to get information out there. We've funded a range of mental health programs and campaigns. We've also funded mental health advisors for business, working with the Hearts Growth Hub. We have put a lot of effort into helping support groups risk assess themselves to continue to be able to meet even through lockdown. So, for example, we were kind of advising them on risk assessment and the kind of things that would enable them to meet to stop isolation. With some of our social care providers, particularly for older people, we've given them advice on how to be able to continue house visits safely. And, you know, we will continue to do that. If people want advice, if charities, providers, support groups want advice, you know, that's what we're here for. We will, you know, get to you and work with you. The other stuff that we have done, of course, is to write and revise continually our visiting guidance for care homes. I realise it's been difficult for people visiting care homes, but our guidance has been more open than many other places because we've allowed visits to happen in circumstances others wouldn't, but we found a way of making them safely happen through provision of PPE. We'd like to do more of this. So there's a lot of stuff that you don't see, but if people think there's more we can do or do better, I invite them to kind of come and tell us and we'll do our best. Does that answer the question, the other bit of it?
I think it does, Jim. And I would certainly say that, I mean, we've done a great deal to publicise the help and assistance that is available and simultaneously encourage people to take advantage of it. So I think it's very important. Nigel.
Thank you, Tim. Yes, congratulations on a very good report, and I think the strategy is incredibly well laid out, actually, and I really applaud that. The separate page on each priority area is just really helpful, and identifying very clearly what the issues are and where the gaps are, I think it is great. I suppose the question I've got is how confident are we that we've got sufficient funding streams in place to fill those gaps over the period of the strategy?
Yeah, thank you, Nigel. Actually, we're quite confident, and I can tell you why, because actually NHSE are funding some suicide prevention work. So we have received, or will be receiving, £300,000 each year for the next 3 years. That is across the ICS. So that includes Hertfordshire and West Essex. We have already mapped out what the first year spending looks like, and a lot of that supports some of those priorities that are coming out in the strategy. So there's specific emphasis with that funding for training, for campaigns, real-time surveillance, and also supporting our voluntary community sectors, so that they can do some engagement work with our residents in Hertfordshire. So I think if I try and split the money across Hertfordshire and West Essex, I think we're looking that we should receive around 195,000 for the next year.
I think we should also point out that if there are additional costs arriving from COVID, there are funds available and quite easily accessed through the Health Prevention Board. So I think it's pretty well financed at the moment.
That's very good news. Thank you. Yeah.
Who have we got next? Susie.
Lovely, thank you. Louise, I just also wanted to congratulate you on a superb report. It's really good reading, and I think what's so encouraging is all the joint working that's going on, and there's so much where there are so many areas that we're just hopefully you know, things are not going to fall through the cracks quite so much as they may have done historically. So I enjoyed reading it, and it's really impressive. Thank you. I just wanted to touch on the training. We were offered as members and some of the frontline staff what looked like some superb training, and it disappeared and filled up before I think almost any of us could flick quickly enough. I just wanted to ask and hope that there are more plans for that, and that then members might be able to partake in that training. Thank you.
Yeah, absolutely. Thank you, Susie. And firstly, apologies. We were not expecting such a significant uptake for the training.
That's because the training is so good.
It is. So that's a good result, really. Actually, we do have plans for more dates for the training, and the additional dates take us up to November.
Oh, lovely.
Because of the uptake, we are also considering the option of putting in some more funds to open out the training to, obviously, to more attendees.
Excellent.
So I very much hope you will see some dates and opportunities for the members to attend.
Fantastic. We look forward to keeping our eyes open for that email, so we click on it really quickly.
Very quickly. Good idea.
Thank you.
It's sold out quicker than Glastonbury, so Anthony.
Thank you, Tim. Sorry, thank you. You're hearing me. Thank you, Tim, for allowing me to speak, and thank you for your interest in this issue. The national signs are good and are alarming, but I would want to all the work that's been done in Hertfordshire in recent years. So thank you for your leadership, and also to Jim. I mean, our aspiration has to be zero suicide, and we're a long, long way away. I think the report does highlight, in a very encouraging way, that the priorities which we've set ourselves and identified in terms of men and in terms of children, young people, in terms of access and reference to the work of rail companies already. It's Executive Chair. I just have a few words about suicide bereavement from lived experience today. And I welcome it as one of the priorities on page 30. It very clearly outlines why this is important, what we know about the impact, and also what the gaps are. And those gaps are very stark and really quite troubling. I think a number of people on the call will be aware that very recently, literally about 2 or 3 weeks ago, a main national report was produced by the University of Manchester, who had interviewed 7,500 people who had been bereaved by suicide, including quite a number from Hertfordshire. It's almost illustrative of how this has been in shadow. That was done almost by volunteer labour with very little public funding, and it highlighted the scale of need and the type of need and the gaps, and I think not present still. One of my questions simply, I do have page 35, there's a reconfiguration of the programme board, and I just would like to ask what the plans are, because I think it's a bereavement board, that's still to be confirmed. The second question I have, just to target encouraging that funding is available, and that's a substantial amount of money. Could Louise just highlight? I understand that progress has been made towards appointing or having a bereavement coordinator, and could you say a little about that? And the third question I've got is a slightly different topic, but I think hitherto one of the most disturbing aspects of society has been the fact that newspaper coverage has often been extraordinarily insensitive. Now, various steps 2 years back involving my sense is that the coverage of suicide is now handled in a much more sensitive way, and that one doesn't read about how people like cancer or cardiac arrest die, you should not be able to meet their death. And may I just finally, Chair, thank you for allowing me to speak, and sorry to go on a little bit long. I thank those who use the phrase taking an individual taking their own life rather than use the word committed suicide, which happened from a time when this was a criminal offence. So I thank those for their sensitivity. Thank you, Chair.
Thank you, Anthony. Your audio was very poor, I'm afraid. So I'll try and go through the questions as I think I heard them. Louise, one was about the plans for the bereavement board and how they're progressing. Somebody left. Anthony, can I ask you to turn the microphone off, please, because it's corrupting everyone else's. Thank you. Plans for bereavement board and how they're progressing. Similarly, with the plans for the appointment of the bereavement coordinator, and it got very difficult at that point. And I think it was comments about how newspapers are treating the reporting of suicide, and finally a plea that it's described as people should be described as taking their life rather than committing suicide. I think, Anthony, that's how I got it. If I've completely misunderstood that, perhaps you could type a note to the chat room.
Thank you, Tim.
Type a note to the chat room.
Thank you. I've done that.
Thank you. So, Louise, can I pass it on to you?
Yeah, absolutely. Yeah, thank you, Tim. I think you did a better job at me at capturing what those questions were. So the first question was around how far have we got with the bereavement coordinator. So I think I'd just like to update you all that the Integrated Healthcare and Commissioning team, they actually commissioned a review of our bereavement services earlier this year. And what that's highlighted is that suicide and bereavement support could be improved. And because of that, one of the actions is to recruit a bereavement coordinator. Now, the Integrated Healthcare and Commission team have agreed to match fund the appointment of a bereavement coordinator, and the Wave 4 funding is doing the other half of that funding. We are about to start the process in terms of developing a job description, and then we'll put that out for advert. So I'm hoping things will move at the beginning of early of next year. So that will be in place. Second question was around media reporting. Now, we in Hertfordshire are very fortunate that last year we developed a media charter, which is standards by which we expect our newspapers and reporters to adhere to when they come to reporting anything around individuals taking their own lives. And my understanding is that all of our Hertfordshire local reporters have signed up to that agreement, which is really good. And we also, what we like to do is we do try and update our reporters on a yearly basis to remind them of this charter and what they've signed up to. Tim, sorry, you're on mute.
Sorry about that. I think we've given this a pretty good airing. I've got 3 hands up. I'm not sure, Mark, whether yours is a legacy hand or not. But at the end of those 3, I'm going to move on to a vote. So I've got Lynn next, then Margaret, and then finally Mark, unless it's a legacy hand. So Lynn.
Thank you. Mine's very, very brief. Thank you, Louise. Brilliant. Absolutely. I wanted to also thank Jim. I had a couple of people contacted me who weren't sure with the current tiers whether support groups are actually able to meet, and there's a lot of the support groups who keep people from taking that final step. Jim very kindly explained that it is fine. But I wondered, could we have something to that effect put on the website so that other support groups who perhaps aren't meeting now know that they can start meeting up to 15, I believe, as long as it's socially distanced. Thank you very much.
Fair point, I think.
Tim, I'm happy to do that. I mean, it's thanks to Lynn for saying that. I mean, one of the things we've done is, and I stopped counting when I got to 65 letters, not years, that is issue support group letters to support groups to reassure them they can meet in case neighbours should complain or the police turn up. So I have a simple letter that I can issue people that says, under these rules, you are allowed to meet, and we could talk to comms and put something out on the website. But also, I wonder if our local press colleagues would get that message out as well, because our local media have been extremely helpful actually in getting some of these messages across. And I know that a number of support groups came through local newspapers to ask questions of me.
Thank you, Jim. I mean, I just reiterate, I think it's extremely difficult to get the message out to everybody. I think our comms team and Jim and his colleagues have put in an enormous amount of effort, and I think all we can do is keep pushing out messages and hoping that it sticks in due course. So thanks for your question, Lynn. Margaret. Margaret, are you with us?
Just trying to turn my microphone on. I think, can you hear me?
Yes.
Brilliant. Thank you. Thank you for a very interesting report. Suicide is a very difficult issue because of small numbers statistically, and I'm aware that we are, I feel what we've done is, particularly the training for spot the signs, is great in aim. I just was going to say, I believe in 2017 we raised the issue that it's actually during the previous year or 2 years of somebody's life rather than afterwards that we are asking families, what they noticed. And whether I was going to ask really what data you're collecting from friends and families, which I thought we asked for then actually, to just see what sorts of things people may have noticed, so that we actually in Hertfordshire are trying to use the engagement with families and even asking bereaved families that I do believe that many of them would feel a therapeutic effect of contributing to better suicide prevention support with their contribution to what they might have needed then in the previous 2 years before somebody actually took their life. Obviously, if they are alerted to mental health services with depression, then that becomes something where you think, okay, we know to engage. But a lot of these suicides, and just looking at the figures, I mean, to go up in Hertfordshire from 20.7 to 37.4%, we've had an increase in suicide between 2017 and 2019. And so I think we need to be a bit careful about, are we doing everything right at the moment? I think we could try to engage, if we can, the bereaved families to help us with the knowledge of the previous 2 years better. I was just going to ask if you could comment on that, Louise, because I think we did mention that 2 years ago, and putting in support in that way for collecting data from obviously Hertfordshire, but also I would say nationally, and how much are they doing that nationally? I did hear what Anthony said about a study on 7,500 people, I think based in Manchester, but it wasn't funded terribly well. It was largely through voluntary data collection or something. So I would like to see a bigger national study that does try to look at the data from families if possible. I wondered whether you could comment on that.
Yeah. Thank you, Margaret.
Thank you.
I think I'd first like to highlight that we do obviously try and engage with our people that have experience, people that have taken their own lives. And we did that by having their representation at the network conference. Unfortunately, we haven't yet got that lived experience at our suicide programme board. And that's not because we don't want to, it's we have been trying very hard to get representation at that programme board. Actually, it's only a couple of weeks ago, actually, I made connections with their national team to ask how we might be able to get that representation. And interestingly, they have a register of a significant number of people that are looking to support local authorities with their suicide prevention work. So we are very hopeful that we're going to be making links and having that representation at our programme board. With regards to data collection, I apologise, I don't necessarily know the actual detail of that granular level of information we're collecting. But I think it's quite interesting what you've raised, and I will take that back to see if that's something have we done. If we haven't, then obviously we can look to take that forward. I'm going to just, sorry, Jim, I don't know if you know any more on that because of you were here a couple of years ago. When
do you mean the family study specifically, or?
Yeah, about the families, but.
So all I can say is that two things really. One is the University of Manchester, the long title of which I forgot, the National Confidential Inquiry into Suicide, led by Louis Appleby, are planning another family study. And we've said to them, because we're involved in national work, we'd be interested in that. But obviously that's subject to government funding and other work. I think the big thing that the Department of Health will prioritise in the current year is asking that National Inquiry Department team to look into suicide as a result of stress from COVID, because as you know, there is a myth circulating that the suicide rates have risen by 200%. And the real-time surveillance work led by Manchester for 9 million people in England says that's not true. The rates have gone up in line with the trend that we've been seeing for several years, which is, not something we want anyway, but we certainly haven't had anything like a major rise due to COVID. They think at present, and I hope that is borne out. So I've said to government that it would be really good if we could prioritise both studies and find the money. But I guess it's not in our hands really. It depends on how much money the National Institute for Health Research has to put into this. Does that answer your question?
There was one follow-up question. I'm very sorry. I meant to say survivors from self-harm and survivors of suicide, that I think it would be very helpful as part of future suicide work. I particularly have experience of this. I have a stepdaughter who self-harmed, and I mean she has had a huge change in her life for positive, and actually interviewing people like that who have actually come through several attempts of suicide, but actually are now healthy, happy, and really through that period of their life, I think it is helpful to talk to them about what brought them through and what brought them to the other side, because I've heard this many times actually, and I just thought we could also reap data from self-harm survivors. And I noticed that you weren't linking suicide to self-harm, but I just thought it would be helpful to do that.
Yeah, Margaret, I completely agree with you. What you'll notice that, yes, we haven't got a whole section on self-harm, because I think that's another area to focus on itself, and it's quite a big work area. But we're certainly not ignoring self-harm and we do recognise that being a risk factor for suicide. So that is going to be tied into the suicide strategy where we can. And I'll completely take back your feedback about getting that learning. So we'll take that back. So thanks for that. I just wanted to.
One observation I was going to make was I think we need to be very careful about using percentages when on low numbers. You know, they do get quite easily, I think, distorted if we're not very careful.
Thank you, Tim. I was just going to pick up on that.
Mark.
Thank you, Chairman, for indulging me. Very quickly, it was a point to Jim, and I laud and applaud the work that Jim does behind the scenes on this particular subject and the consultations that he does. I just wanted to make a plea and really endorse what Margaret was saying about self-harm and the linkage between that and suicide. But I wanted to make sure that, Jim, you reach out to the Mount Prison and prisoners who are there. Another important avenue, I think, that we ought to be engaging with. I'm sure we are, but I make that usual plea. It's a particular thing of mine that we include everyone and that we are inclusive in what we do in Hertfordshire. It was a plea, really, more than a question. Thank you, Chairman, for the indulgence.
Thank you, and thank you, Louise. It's an important subject, and I think you're covering it very, very well, and I think we all appreciate that.
Lovely, thank you.
So we are asked to note the report, so could I invite the panel to do so in the chat, please?
Tim, sorry, this one's a recommendation to Cabinet.
I just beg your pardon, yeah. We're asked, in fact, quite right, to recommend to Cabinet to agree and adopt the Hertfordshire Suicide Prevention Strategy 2025. That would seem to be unanimous. So we agree, Stephanie?
If I may, Tim, mine doesn't seem to have come up, but I'm unanimous with you.
Thank you very much, Ron. We know you're with us. Right, moving on, if I may, to item 4 on the agenda. Whole Systems Obesity Programme update. I think Sue Matthews, are you presenting this with Faith and Jade?
Hi Tim, I'll be presenting Faith Eddleston, Health Improvement Lead.
Okay, Faith, thank you for being with us.
Hello everyone, so I'll provide you with an overview of the paper that was submitted to panel, which gives you an update of the Whole Systems Obesity Programme in Hertfordshire, since this approach was first outlined to panel back in June last year. As you know, this is a programme of work which aims to prevent excess weight in the population. And in November last year, a Whole Systems Obesity team was formed, and that comprises of myself as Health Improvement Lead, a projects officer, and we're managed by Sue Matthews, consultant in public health. And the purpose of the programme really is about the prevention of obesity. So it's not so much about the treatment end or provision of weight management services. We do already do that successfully, commissioned by Public Health and the CCG and other partners, but rather the whole systems approach is about seeking to understand the wider factors at play that may be leading to excess weight in our population and how we can address that. So, for example, the wider determinants linked to obesity include the environments that we live in, our access to green space, the food environments around us, and the places we spend most of our time in, such as school and workplaces. And a lot of us are working from home at the moment, so maybe not physically active as much. So places are really key determinant in our health. Other factors as well, such as societal and cultural factors, such as the media and education and family practices, can have an influence on our weight. So in terms of progress of the programme, it started to build momentum in the early part of the year. We established a new partnership called the HOP, the Hearts Obesity Partnership. And this is a membership of the district councils, the CCGs, University of Hertfordshire and Heart Sport Partnership. And the purpose of this group was really to collaborate around some of our actions and projects under the Whole Systems Obesity programme. Just to note, we do have a wider network, the Healthy Weight Network, which has a much wider stakeholder membership, but that's more about information sharing rather than specific actions or projects. So we formed the HOP back in early part of the year, got together in March and created a shared vision. But then unfortunately, as you know, the pandemic hit us. So a lot of our work got put onto hold because we were involved in the COVID outbreak response, as were our partners, and their priorities sort of shifted for a while. The good news is since September, we've managed to reconvene those two key networks, the Healthy Weight Network and the HOP. And that's really positive because a lot of our work really will only be successful if we have good engagement with our partners, because a lot of what we're trying to achieve is not in the direct control of us in public health. But what I really want to talk about now, as highlighted in the report, is the food poverty needs assessment. So as you all know, COVID-19 has really shone a spotlight on food poverty, and despite the efforts of the government, there has been, unfortunately, unavoidable economic impact. And we know those that are, might be economically unstable, so on 0-hour contracts or self-employed, may be pushed into poverty and therefore experience subsequent food poverty. We know nationally it's a growing issue. And anecdotally, we know in Hertfordshire it is an issue that seems to be growing. So, for example, food bank use is increasing. And there is always also some evidence about a kind of new demand from different type of service users that may not have accessed food banks and that kind of support before. So what we want to do with the food poverty needs assessment really is to build an understanding of the local picture. Much like obesity, food poverty is a complex issue. It's usually as a result of being on a low income, but there are many factors, of course, that can affect being on a low income. And this then impacts on someone's affordability of food or access of food to make up a healthy diet. So, and on that, we know that people in food poverty are much less likely to be eating a healthy diet. And that has particular risk around different health problems, including poorer physical health, such as excess weight and dietary related illnesses, including diabetes, but also poorer mental health. We also know from the evidence there is a negative impact on young people in terms of their learning and social development in school. Evidence suggests they may perform less well in school. So an overall negative impact from food poverty. So as mentioned, we know it's a nationally growing problem. The purpose of the needs assessment really be to understand the scale of the problem for Hertfordshire. And we want to know and understand how many people food poverty is affecting and who is at most at risk, and where and why, and what can we do to better support those people or prevent them from ending up in food poverty. And that's what the needs assessment will seek to understand. We will consider best practice examples from around the country, particularly at what a local level can be done and the role of local authorities. And we will use this work to inform our wider work programme around addressing inequalities in health. Just to mention, we have formed a stakeholder group. At the 1st of December, we first met, and that's a mixture of people that are sort of working on the ground, if you like, with those experiencing poverty or issues around food poverty. So we've got a mixture of food banks, services that are supporting vulnerable people, and sort of money advice services as well. And what we've seen is at this current time is really good engagement from people. There's some really good work going on around the county. So I think the needs assessment coming in at this time presents a really good opportunity for us. So we will aim to have a first draft by May. As ever, there may be some curveballs thrown at us, but that's certainly our ambition. And then to bring back a paper back in June, July. The other opportunity that we have at the moment is the University of Hertfordshire. There's 2 members of staff that will be supporting us on delivering this needs assessment. and they were focused specifically around gathering local insights so that we can really understand from people themselves who may be experiencing food poverty what might be the issues or barriers that they were facing in accessing services, and just to understand their perspective as well. So over to you. Welcome your feedback.
Faith, thank you. I mean, this has been going on all year. We discussed this, I think, back at the beginning of the year, certainly. I think it's an extremely important subject. It's something we need to get to grips with. And from my perspective, it's driven by, I think, a desire to understand not only the causes, but how we best deal with it. It seems to me we deal with a lot of these issues, a lot of work going on, but perhaps in silos. So I'm hoping the outcome of Faith's group, it'll bring all that effort together, and also put together a case which is based on fact rather than anecdote. And so I thank you, and all power to your elbow, Faith, for the work you're doing. There's a couple of hands keep going up and then going out again. So I hope I've got this right. I think Lynn came up first.
Thank you very much. Just a couple of points, if I may. Thank you for that, Faith. I do look like someone that's in, food poverty, but I think the other group where there's a real issue is around the key workers, the ones who are the lowest paid, who are working every hour God sends at the moment, and probably don't get home until it's near enough kids' bedtime. I think if we can speak to some of those, are we really expecting them to then go home and cook a healthy meal? And I suspect that is just not happening because practicalities. You can't start feeding kids at 10 o'clock at night when they're at primary school. So I think it's not only those who are on the food poverty bit, it's those who are low paid but just working all the hours, our shop staff and all the rest of it, our care workers. The other bit is if you've got Heart Sports Partnership on board, I was really involved with some local football teams that did young people and Sunday Morning League. And the Sunday Morning League, most of those who went there were exactly the young men that we were talking about with the suicide strategy. A lot of them were single dads, a lot of them were low paid. Two things, this whole club of 23 teams folded, not because of finance, but one, having said that, one was the fact that the cost of using the pitches just went up, and that was financial. But the biggest one is getting volunteers to run these clubs. And I wondered if that's something you could ask the Heart Sport Partnership, whether they are struggling to get the volunteers to do that, because we're asking volunteers to take on so much, but if we haven't got them running the youth football team, the youth or other teams, and then the adult teams, the sport that goes alongside the healthy eating is just not going to happen. Thank you.
Thank you, Lynn. Yeah, I think that's partly where the stakeholder group comes in, which has been really useful to understand that different perspective and understand certainly different groups of people that we may not have considered before, such as key workers, people working different types of hours and unsocial hours and that kind of thing. So we have the Money Advice Service who've highlighted considering the issue holistically and the issue around poverty, not just food poverty itself. We do have Heart Sport Partnership as a member of that stakeholder group, more from the angle of delivering the holiday hunger programme, Fit, Fed and Read. I can certainly take that back. I'm not sure who would be the best person to ask Heart Sport Partnership, but around the volunteers for the youth football team, but I can take that back.
I think as someone who ran youth football teams many years ago, I think there are a whole range of issues there, and including how our volunteers are supported as well. But that's an entirely different issue, perhaps. But good points, Lynn. Thank you. Fiona.
Thank you, Chairman. The partnership working has been mentioned. So how is education engaged as a partner? and specifically looking at prevention and future generations. What are schools teaching young people about budgeting and cooking healthy, cheap food?
Thank you, Fiona. In terms of the stakeholder group, we have our family centre service leads, a couple of them represented. We don't have any leads from schools attending that group, but we have partners that are working directly with schools, so we're kind of through that angle. But yeah, that's something we can look into. Certainly education will have a role to play in that budgeting, cooking meals as well, that kind of thing.
So if you can look into that, and would it be possible if you could report back to members of this panel by email, please?
Yeah, sure.
Fiona, can I make the point that Faith will be coming back to this group, hopefully in the spring, with an update on work to date. So I'm determined that this panel should be kept well appraised of the work that's being done, and has a role, has an opportunity to influence that work. So it will be coming back. Nigel.
Sorry, took a while to find the mute button. Thank you very much, Faith, and really welcome the focus on food poverty. I'm sure you know all this, but I did a little bit of Googling last night and just came across what Sustain are doing in terms of advice for local authorities. And also they've got some very good examples of what other local authorities are doing on food poverty action plans. I had a brief look through those. They all looked a little bit wishy-washy, the ones I looked at. And my question is, what do you think, from what you know already, are the biggest action drivers that we can get behind here? I mean, I totally echo what previous speakers have said about education and sport. And I just want to comment, I don't think Fed, Fit and Red was mentioned at all in the report. Not a criticism, just an observation. I think it's really good if we can link all these things up together.
Yeah, thank you, Nigel. So I think it's hard to say at this point. Obviously, the needs assessment, any recommendations we make will be based on the evidence. Certainly from around the country and from Sustain, it looks like food poverty action plans or having an overarching kind of poverty action plan is an example of some good practice. But I think the starting point with that is having the evidence to start with, and also having some kind of alliance or group that can feed into making those kind of recommendations and actions. So I do think that could possibly be one of the recommendations that we make. It's not something we have in Hertfordshire at the moment, an oversight group, if you like.
Yes, yeah. Thank you, Faith. And I think a lot of this has to be done at national level, doesn't it, in terms of policy on food and how we improve the availability of affordable, healthy food in supermarkets and other outlets. But that's not something that Hertfordshire is going to be able to solve on its own.
Thank you. But you're on mute, Tim.
So this is going to run and we'll be coming back on regular occasions. So there'll be plenty of opportunity for further comment in due course. So at that point, I'm going to invite Margaret to have the final say before we vote. Margaret.
Thank you, Chair, and thank you, Faith. Well, you probably don't know my background, but I was head of public health intelligence in the past. I did lots on childhood obesity, and we now have the National Child Measurement Programme. Can I just check that did continue going through COVID, or has that been delayed during COVID? Have the school nurses been able to do the Child Measurement Programme? And to add to that, we in Hertfordshire have got Fit, Fed and Read, but I don't think we've really ever measured the health impact assessment of Fit, Fed and Read, and we could, because we should have the National Child Measurement Programme readings on those very children and to see how much we are helping them to lose weight. I think it's been going for 3 years, and we have got those specific children, and it would be really helpful. I notice, so epidemiology wise, we have been able to do longitudinal studies in COVID, tracking people, and I'm hoping now that we can do the longitudinal studies on the National Child Measurement Programme, which we previously were deterred from, really. They used to do sort of, we could do school analysis, but actually it will be really helpful to see how much our Fit, Fed and Read programme is really affecting those children. And then I'm going to just mention inequality to access, because the Fit, Fed and Read programme is only available, I believe, for, is it 8 to 12-year-olds? I'm trying to remember what age it is, but it isn't all children. And so there could be a case for saying, right, well, it works in this age group, can we actually extend it to other ages? And the other thing, sorry, I have 3 questions. Adults. Now, adults, we don't have good denominators for adults unless we have discussed this before, unless we encourage, and through GPs, self-measuring height and weight and helping GPs to collect that data. And then we'd really know what impact we're having in Hertfordshire through our social prescribing. And I believe that social subscribing is offered for people to lose weight through Weight Watchers. But I was going to ask, why don't we equally socially prescribe Slimming World, who are doing quite a good campaign in COVID about mental health and exercise, as well as monitoring weight and supporting people. And I'm interested to try to measure how successful our health impact of social prescribing is, if we possibly could. Those are my questions. Could we do that in the future? And I think, you know, that's really what our needs assessment should be in the University of Hertfordshire, is to look at our whole denominators of adult obesity. It's easier for children because we've got the National Child Measurement Programme. And could we engage self-reporting of height and weight with GPs? I know it won't be perfect, but cost-wise, it's the only way to do it, I think, at the moment.
I think, Margaret, if I can make the point on this, it has been made.
But no action has been taken yet, so I'll have to keep making it.
Faith and her colleagues are taking all this on board. It's an incredibly broad range of issues involved in this. We won't crack it all in one go. And as for whether we use Weight Watchers or Slimming World or any other available,
it's locally it's very discriminatory locally if you haven't got.
Sorry, I'm talking. I wasn't interrupting you.
That's all right.
We do look at how we commission on a regular basis, so all these things will be taken into account, and we will move it forward.
Can I ask Faith for some answers for National Child Measurement Programme, please?
Faith, did you want to finish up on it?
Yeah, I think I'll pass over to Sue on that one because she knows.
Yeah, I put the recently published guidance in the chat. It was not. Obviously, it didn't happen during lockdown because most of the schools were closed, apart from for key workers. But there was some national guidance that came out in November about the restarting of the programme.
So is there a year missing effectively, or is it patchy?
Well, I think it's all nationally set around how the programme will recommence. So the answer should be in the guidance. It's a national programme and it's commissioned locally.
Thank you, Sue. I think the point to make is that this work is not complete. In all the points raised, I'm sure will be considered and put into the thinking. And when they come back, hopefully in May, with an update on where they've got to, I think that's probably a more appropriate time to perhaps be a bit more forensic in examining the outcomes of work to date.
Can we take part in the whole system obesity?
Well, you are taking part in it through this panel. You'll be getting the report back. You'll be given an opportunity to read it, take it on board, and put input into future iterations. So I hope every member of this panel will take part and give considered inputs. I'm going to draw a line there because I think there's an awful lot of work going on and an enormous amount of work to do. So I'm going to thank Faith and Sue and Jade for the work they've done to date and for the work I'm sure they're going to do in the future. So could I invite the panel to note this report in the normal way through the chat room? James, I think we can. Are we okay with that, Stephanie? Yeah. Brilliant. Thank you very much. That's passed. Moving on to item 5 on the agenda: public health's contribution to developments and achievements of housing-related support in complex needs services. I think we've got Natasha Welsh with us.
Hello, yes.
Just wanted to say that I asked for this to come before the panel because I'm not always sure that everybody, I'm sure the panel does, but everybody outside the panel quite understands the reach and impact of our public health teams. And I think some of the work that Natasha and her colleagues have been doing on this is really quite important. So thank you for being with us this morning, Natasha, and over to you.
No problem, Tim, and yeah, thank you. And this report really is to showcase some of that work really that's been happening, particularly during the COVID period. And our response to rough sleepers and homelessness, and the joint working that's been taking place between the departments, so particularly between public health and adult care services, and with our 10 district housing leads as well during the pandemic. So in summary, during the last 7 months in particular, several work streams have formed that were developed initially in response to COVID-19, but that now continue to evolve. These work streams will become key in driving the rough sleeper agenda and will form a significant part of the Hertfordshire Supporting Adults with Complex Needs strategy. So before I move on to the various initiatives that we've been working on over the last number of months, just a brief bit of background, which I'm sure all of you will be aware, but the district councils within Hertfordshire have responsibility for general housing provision as well as statutory responsibility for homelessness. But the provision of housing related support lies with adult care services, and that public health have supported this framework through the commissioning of substance misuse specific housing related support services. And we have commissioned a provider called Emerging Futures to identify gaps in provision for those with substance misuse issues who also have issues relating to housing. And I'll come on to talk more about Emerging Futures later on, because they've had lots of involvement within the initiatives that we've been taking forward during the pandemic. So just very, very briefly around the strategy, just to give this some context, public health has played a key role, as you would expect, in the development of the complex needs strategy, which adult care have been leading on. To ensure that improving health and well-being and preventing ill health due to homelessness is, of course, firmly embedded within the strategy's aims and objectives. The main priorities of the strategy are to prevent and reduce care and support needs, to prevent homelessness and rough sleeping, connecting lives and helping people to supporting people to remain in their homes and connected to their local communities, and of course improving health and well-being and preventing ill health due to homelessness. So the strategy informs the County Council's approach to redesigning housing related support services for those with complex needs, for March 2022. And during the last number of months, during the COVID period, it's kind of given us some real good opportunities to kind of test out the principles of that strategy, opportunities that perhaps we wouldn't have had if COVID hadn't hit, actually. So that's where the number of initiatives have come in. So firstly, in April 2020, the Hertfordshire Accommodation and Recovery Coordination Cell was formed, and this is a multi-partnership between the district local authorities, adult care, public health and local NHS partners to plan and manage the response to COVID and rough sleeping. And a big part of that cell was to consider the government's Everyone In initiative. And just for those of you who aren't aware of the Everyone In initiative, it sought to bring in rough sleepers off the streets in Hertfordshire to protect their health and to prevent wider transmission and reducing the impact of COVID-19 on those facing homelessness, and of course to ultimately prevent deaths. So the accommodation cell enabled a county-wide response to Everybody In, and to support the identified needs of our most complex and entrenched individuals that have multiple disadvantages relating to mental health, substance misuse, offending and domestic abuse. As part of this cell, Public Health developed what's now called the Rough Sleeper Tracker, because we were very aware as to the numbers that the districts were bringing in, the number of rough sleepers that were being placed in emergency accommodation during the pandemic, but we weren't quite clear on what those support needs were of the rough sleeping population. So Public Health developed, or I developed, a tracker. It was quite a big Excel spreadsheet, if I'm honest, that we were asking each of the 10 districts to populate with all of their rough sleepers, to identify each of the rough sleepers, and for us to have a better understanding as to what their support needs were, whether they had substance misuse, whether they had mental health, whether they were a care leaver, whether there were no recourse to public funds, and what kind of emergency accommodation that they had been placed in. So COVID care for the symptomatic group, for example, COVID protect for asymptomatic and high clinical risk groups, etc., etc. And from this tracker, Public Health then identified priority cases for each of the 10 districts. And when we talk about priority cases, so it's those with identified support needs that are currently not receiving any support, or are only receiving partial support from services. And then with those priority cases, we then asked each of our 10 districts to set up multidisciplinary team case conference meetings. And the housing option managers within each of the 10 districts were then led on the setting up of the MDTs alongside representatives from substance misuse services, mental health and probation. So these primarily were one-off case conferences to discuss the priority cases and to ensure that their support needs were being met. And again, it enabled us to, we know that the MDT approach was what was needed to start forging partnership working between the services, but it just hasn't happened, and it wasn't happening within Hertfordshire. So again, it provided us with an opportunity to kind of test this out. Each of the 10 districts went ahead with their MDT meetings. Some areas more successful than others. It was very much dependent on how that meeting was chaired and managed and the input of the representatives. We have public health colleagues within the data and analysis teams evaluating that MDT approach, because of course that's going to provide us with some really rich information around what works well, what doesn't, what makes for a good MDT that we can use as part of the housing related support model for March 2022. So that evaluation continues. Now, we then, of course, hit kind of phase 2 of the lockdown, where we then again asked the districts to reinstate the MDTs, to look at priority rough sleeping cases again. But we've also kind of revamped that tracker. And the tracker now also supports the MDTs in tracking all of the actions that have been discussed as part of that multidisciplinary team approach, but it also tracks distance travelled for each of those service users. So it gives us some clear outcomes. We use a RAG rating for the various outcomes that are being achieved for service users, because that, also reinforces the MDT approach and continues to encourage partners to be around the table, because they can clearly see the positive outcomes this is having for service users. So those MDTs continue. One of the areas that have really embraced the MDT way of working and where it's continued to really evolve is in Watford, and Watford is one of the areas that obviously public health and adult care services continue to really kind of have a close partnership working with, because we are gathering a lot of intelligence from the way that they are delivering their MDT that will again inform the future commissioning model. Now, just briefly, in terms of Watford, they, as part of Everybody In, they accommodated 80 rough sleepers in literally a period of a few days over in Watford as part of phase 1 of the lockdown. And their MDT continues to build on the momentum of the partnership approach. And it's called the Watford Task Force. And it's got various partners now around the table, and we are looking at ways in which we can also include which we can join up with PCN MDTs as well. So that's an area that we're keen to progress with. And again, in terms of what's working well in Watford, we're then hoping to replicate across each of the 10 districts across the county. And all of the districts, it's taken us a while to get them on board with this and what we're trying to achieve. And of course, with them completing or populating the tracker, that was quite a task for them. But we kind of all come together and we all agreed that this is what we need to do to truly understand what the support needs are of our homelessness and rough sleeper population. And actually, as a result of that tracker and the rich intelligence and information that it provided with us, it then enabled the districts to then put their bids together to access the Ministry of Housing funding that came in, that was introduced in May and June of this year. So just briefly, in May, the Ministry of Housing, Communities and Local Government, MHCLG, announced 161 million for longer term move on accommodation for those rough sleepers that had been placed in emergency accommodation. And then they also announced in June 105 million to provide rapid support interventions for those currently in emergency accommodation. So MHCLG announced both short-term and long-term funding. Again, each of our 10 districts had the data that they needed to support and evidence the need to access this funding. And all of our 10 districts were successful in their bids, in their applications for both the short term and long term, or either or. They either applied for both or they applied for the short term as well as the long term. Out of those 10 districts, we had Stevenage and Broxborne that included our public health commission provider, Emerging Futures, as part of their proposal for Emerging Futures to go in and provide intensive floating support to those rough sleepers within Broxborne and Stevenage that had been placed in emergency accommodation, to prevent them from then going back out onto the streets. So Emerging Futures are now providing that intensive floating support within those two areas up until March 2021. And that will be evaluated as part of MHCLG in the hope, if it achieves positive outcomes, further funding will then come in from MHCLG to continue with those initiatives. So, you know, again, really, really positive and positive use of the tracker, and reinforce the need as to why we need to collect, why we need to understand the needs of the support needs of our sleeper population. That then leads us on to the Broxborne Pilot. Again, another opportunity for us to test out something quite different. We started looking at the Broxborne Pilot before COVID, then of course COVID hit, which scuppered our plans somewhat. But we're now back on track with this. So this pilot aims, again, to test the principles of the strategy, a single pathway into services that meets a spectrum of needs with those with complex needs. But it offers a housing first type accommodation. And again, just for those of you who aren't aware of what housing first is, it's basically the notion of you can't expect somebody to engage in treatment services, support services, if they're on the streets, if they're rough sleeping. So the notion is you provide them with a safe place to live first, and then of course we can start working with them to start engaging them in services. So before housing first, it was very much, well, somebody has to engage in a service before we would start, you know, thinking about their housing needs. This is kind of turned that on its head. We provide them with the roof over their heads first, and then we can start engaging with them. So Broxborne is an area where we wanted to test out kind of a true housing first model. It was an area identified because it statistically has a significant higher rate of statutory homelessness than the Hertfordshire average. And this pilot is, again, a partnership approach between B3 Living, who have identified a 4-bed property suitable for this pilot, Emerging Futures, who will be providing the support elements, and the costs of this pilot are being met between public health and adult care. And the pilot is due to commence in December, end of December, beginning of January until March 2022. And again, it will provide us with, it will be evaluated through public health, and it will provide us, it will inform us as to what works well, which can determine whether it could be a template for future service provision. So we're all really excited about the Broxborne pilot. And just lastly, while all of these initiatives continue to develop and evolve, a review of the current housing related support services is underway, being led by adult care, to gain a clear understanding of housing related support provision that's been in place over a number of years. And a measured approach will be taken in relation to developing commissioning models, and a phased approach. A phased procurement process will commence spring of next year, with a new model, a new HRS model, to commence in April 2022, which will incorporate all of our findings from all of the initiatives that we've been trialling out over the last number of months. So yeah, that's where we're up to. I think, you know, for us, in terms of COVID, it's provided some really fantastic opportunities, again, to kind of test out the principles of the strategy, but to also forge those relationships, but across the departments, across the districts, and across commissioned HRS providers. And, you know, so, you know, it's just been fantastic, really. A lot of the work that we've been doing we have managed to achieve in a very, very short period of time, whereas before it probably would have taken, 18 months to get some of these initiatives up and running. So we've managed to achieve a heck of a lot in a very short period of time. Open to questions.
Yeah, Natasha, thank you very much. I wanted you to come and present on this because I think it demonstrates the breadth, or part of the breadth of influence that public health has across the county. And I think it's an interesting subject because obviously as a county council, we don't have a direct responsibility for housing, but I think what you have done is demonstrated the benefits of collaboration and cooperation between all the authorities. And I'd like to single out, if I may, because it was work that was already been doing, was the work of Emerging Futures. You've mentioned them, the work they do in providing support for people suffering from alcohol and drug addiction. I think it's magnificent. And the support they get from charities like the Living Room, some wonderful work going on, and all power to your elbow. I'm going to invite Nigel to ask the first question. And Nigel, I note your comment about a break. I did say at the beginning that we would break after 2 hours, but I think we'll break after this topic. So I've got a few hands up. So I've got Nigel, Fiona and Margaret.
Thanks, Tim. And yes, sorry to labour that point about getting up. David Andrews has introduced this in scrutiny. We all have to get up and walk around for 5 minutes every hour. I think it's a very good idea when we're sat in front of screens all the time. Right. Thank you, Natasha. I mean, your passion on this comes through loud and clear. I found that really interesting to listen to. A couple of concerns, obviously. I mean, as ever with funding issues, government funding always comes in very short, sharp things. We've got a deadline of March 2021. It's not very far away. How confident are we that things can carry on beyond that? And what are we doing to lobby government to get those decisions done? Because I mean, was there anything in the spending review last week on this?
We are in constant discussions with MHCLG. MHCLG are a part of our accommodation cell, so they continue to update us as to where things are at. They were at our accommodation cell on Tuesday. Again, they were talking about, it's hopeful, it's likely that they'll continue with the funding beyond March for the shorter term Next Steps accommodation programme, but no guarantees. Very much dependent on the outcomes of the various initiatives across the districts. We have robust reporting mechanisms in place. I can speak on behalf of Emerging Futures, who are delivering the floating support in Stevenage and Broxborne. They have robust KPIs to meet that have been very much set by MHCLG. They report into me, they report into Broxborne and Stevenage, and we're hoping that we can, demonstrate good outcomes from this, that we can report back to MHCLG to continue with the funding beyond March. But in terms of the longer term funding, I believe that is until March 2022, but the shorter funding, yes, initially it's until March 21.
So the applications that went in from the districts and boroughs, is that the long term or the short term?
Both. So across each of the 10 districts, they applied, some of the districts applied for both the shorter term and the longer term, whereas other districts just applied for the longer term. Okay. So there's a bit of both across each of the 10 districts. And
is it possible to get a breakdown of which districts have done what? Is that available?
It is available. In fact, Sukhvinder Rai and Sukhvinder, who works in the complex needs within adult care, of course, work very closely together. That's one of the things that we've been asking the districts to do, so that we've got a clear understanding as to what they've applied for. But before they made their applications, it was a bit of a plea to the districts, really, that their applications were, of course, aligned to the strategy, which they are. But we have asked for that breakdown from the districts about what they've applied for and what's being delivered within each of their areas. And we're almost there with that. So once we've got that, Nigel, yes, I think we can share that.
Yeah, I'm sure I wasn't the only member to sort of hear your comment about variation across the districts. Yes. And the dependence on who was doing what and how, and thinking, is that my district that's failing? please let us know so we can do something about it.
I wouldn't go as far saying any district had failed during this process.
I'm sorry, I do want to put those words.
No, it took us a while to get some of the districts on board, but I must say, Nigel, you know, it really feels like we've got a good partnership across all of the 10 districts now. You know, Watford in particular, of course, because they have they have you know, quite well resourced in Watford, and they have a high population of those with complex needs. But all districts now are certainly on board with what it is we're trying to achieve.
Great, thank you very much.
It seems to be we can argue all day about timing and consistency, but certainly from what I've seen, I think everybody's working as hard as they can. And I think it also is incumbent on us to remember that government funded taking homeless people off the streets and putting them in the hotels as COVID outbroke. Outbroke? I don't know, that's not a proper word, but you know what I mean. And has since put in over 266 million into ongoing issues. So I think it's incumbent on us all to take that and move on with it as energetically and as carefully as we can, and certainly Natasha and her colleagues are doing that. Who we got next? Fiona.
Thank you, Chairman. So looking at the report, just going into Microsoft Teams, yes, and the background, that's item 4, and the 4.1, it states that evidence suggests that simply having appropriate long-term accommodation does not achieve positive outcomes for those who are often the most socially isolated and excluded people within our communities. How does that fit in with the Housing First approach?
So let's just take Broxborne, for example, where we are looking to develop a Housing First approach. So we've got B3 Living, who's providing the property. And then we'll have Emerging Futures, who will be going in to provide the support to those residents of that property. Now, of course, Emerging Futures are primarily a substance misuse service. We have HPFT, which is the Hertfordshire Partnership Foundation Trust, who are on board with this pilot as well, and who are very keen to work alongside or to work in partnership with Emerging Futures to work with those residents that have we refer to them as complex needs. I prefer to refer to them as those with multiple disadvantages, but those who have substance misuse and coexisting mental health, very much bringing the services together and to the service user within the property to bring the support to them. So yeah, property being provided by B3 with the support being provided by our commission providers.
Thank you.
Okay, thank you. Margaret, do you have a question? I know your comments in the chat.
Sorry, I was just trying to reply to Jim, but I will write an email. Okay, this is actually to do with this one. So I'm really encouraged to see this report. I don't think I've ever seen public health manage to get MHCLG funding before. I am really excited about that. And I just think I was going to say I do know about amazing work when I was head of public health intelligence in Watford by Dr. Tim Robson, who actually was a GP who specialised, I think it was Cassiobury GP practice, and he, I suspect, is still doing it, but he set up a special homeless persons sort of counselling. He was just amazing, and I just think that we've got some real amazing champions in Hertfordshire for this. I know another GP in one in Hatfield called Fiona Martindale, who's also a bit of an expert at homelessness and rough sleeping. But actually, I was going to say we do need to focus on what happens after the emergency accommodation. I've been helping somebody who was who's in my patch, and actually financial advice and help when they are on universal credit, and it totally changes if they go through homelessness, and how to cope afterwards, I do feel is a whole area that we should be flagging up for funding and support as to how do they manage their finances as they emerge from emergency accommodation. They get their flat and then they can't afford their flat because they have to work out how to pay for it, and haven't really been had much help with it. And I just think, being very, very practical, we need some people alongside those who've gone through emergency accommodation to really have what I'd call emerging hopeful futures or successful futures. I mean, it's quite hard. Some homeless people actually don't want to be accommodated, and you have to help engage them until they believe in themselves again to really want to have accommodation for various reasons. So that sort of what you call, complex needs, or having the people particularly for finance in COVID especially, has been, this particular person I've been helping has really needed. I can't do everything to help them, and having somebody who is really earmarked as their sort of key support worker is actually really needed, I would say. I'm a bit worried for their lives falling apart after they come out.
Sure. And I absolutely agree, Margaret. And just on your point there, in terms of Meadowell surgery, which is what Tim Robson was involved with, Meadowell, very much part of the Watford task force, and they are represented at their MDT meeting. But yeah, fantastic service.
I'd love to you could do a showcase of the last 20 years because Watford has done what I know they sort of trailblazed that specific personal work.
And we need a Meadowell across the whole of Hertfordshire, to be quite honest. But they are very much embedded as part of the MDT in Watford. And yes, you're right. In terms of initially getting people into safe, secure accommodation, that's all very well, but we need to make sure that the support is ongoing once they've moved on from that accommodation as well, because of course it was also the same issue for those as part of Everybody In who were placed in hotels as part of the emergency response. People that we've been trying to engage with for years, and all of a sudden we had an opportunity because we had these people placed in hotels, and we had services working with them to see whether we can then get them moved on from the hotels into other accommodation, but ensuring that the likes of, again, Emerging Futures that provide floating support continue to engage with people out in the community, to ensure that people are able to maintain and sustain their tenancies, because it's a huge leap, isn't it, from going to somewhere like a hotel where they have lots of support wrapped around them to then being on their own in the community, not really knowing how to do day-to-day budget management, how to shop. But so it's ensuring that we have the services that are going out there in the community, ensuring that people continue to be supported. Absolutely.
Thank you, Natasha. Margaret,
I've got a naughty follow-up, which I do think is helpful.
I'm sorry. Can I note your comment? Margaret, please let me speak. I note your comment. You want to be away by 12:30, and I think others would like to as well. So I'm going to move this on. Lynn.
Thank you. Just a very quick response, actually, to Nigel and partly to Margaret. Thanks, Natasha, that was brilliant. But I just wanted to say I actually chaired a scrutiny for the one in Hatfield, what happened with the homelessness, for exactly for the reason that you said, so that the things that we learnt can be used to actually lever in extra money so that we can continue. So I wanted just Nigel to know his division hasn't been left by the wayside, and also to say that one of the things that they have been doing is the follow-on work that Margaret was talking about. So it might be a good idea to check that instead, when we're personally helping someone, to try and get them into that system of support. But I think what's been happening across the county, in a way, it's sad that it's taken a pandemic to get everybody in. But now we've done it, for goodness sake, let's not chuck everybody out because the funding's not there, and let's get some really good responses. So thank you.
And I agree, Lynn. I mean, I'm determined that what we've achieved over the last 7 months, we now continue with. And I think all of us are determined for that to happen. So, yeah. Thank you, Lynn. And thank you, Natasha. I think, as Lynn said, that was a superb presentation. It does demonstrate the breadth of the work that you and other colleagues in public health are doing. Thank you very much. No problem. Right, at this point, before we go on to the final item on the agenda, I'm going to take on board Nigel's comments about a break. So should we just take 5 minutes? A quick break, and then we'll come back for the final item if everyone's happy with that. It's certainly aimed to finish in time for Margaret to go at 12:30.
We need to vote, Chairman. We need to vote, Chairman.
Oh yes, sorry, I beg your pardon. Right, hope nobody's gone yet. Please, let's vote on noting the paper. Thank you. Thank you, Mark. Grand, I think we can say that's unanimously supported. So thank you very much. 5 minutes and we'll be back. Right. I hope everyone's had a suitable time for a break, coming back refreshed. And we go into our final item, which is item 6, Sustainable Hertfordshire Strategy Action Plan. I think we've got Julie Greaves and Bethan Clements with us. And this is really bringing back something that's already been reported to this panel. So I guess we're reporting on progress. Who's going to kick off with this one, Julie or Bethan?
Yeah, I'll start, Chair.
Is that Julie?
Yes, hello, hi.
Welcome.
Thank you. Yes, good morning, Chair, good morning, panel, and thank you very much for inviting me back to speak. As Tim says, this isn't new to the panel. We have been and presented the Sustainable Hertfordshire Strategy before, but this particular paper is about the action plan, which is a lot more detailed than the strategy itself. And I have a few PowerPoint slides just to take members through the action plan because it is quite detailed. So I'll just share my screen. Okay, so you have the panel paper and attached to the panel paper is the appendix, which is the action plan itself. And this morning we're specifically looking at actions relating to public health and prevention. Just the journey so far very quickly. As you're all aware, the County Council unveiled its new corporate plan and also declared a climate emergency last July, and also then made the commitment to develop a Sustainable Hertfordshire strategy by the end of that year. The Sustainable Hertfordshire strategy was prepared and was approved at March Cabinet this year, and also was alongside a recommendation to prepare a detailed action plan to support the strategy. The strategy itself sets out our initial policy approach to how we're going to tackle climate change and deliver on sustainable Hertfordshire agenda, and is split into 3 areas of influence in terms of lead, enable and inspire. So to be a leader in our own operations, this is about how we can manage our estate differently and also manage the services that we deliver differently. And then the other much bigger areas are enable and inspire, and that's through our policies and programmes, and also then by inspiring businesses and residents across Hertfordshire to act differently, to be able to make a much greater difference. So Appendix A is the action plan. It is a very detailed document, and I appreciate that some of you may have seen it before. It is over 200 actions listed within the action plan itself, and we've categorised the actions into quick wins, which are those to be delivered within existing resources, and they can be found pages 7 to 12 and 27 of Appendix A. We've got the key works programmes, which are areas that needs further investigation, but that we'd like to do within the next 1 to 5 years as a matter of urgency to put those in our normal business. And they are set out in pages 13 to 24 and 27 to 30. And then future works programmes are fairly large areas of work, or maybe fairly large areas of work that have been identified, but we really do need to do further scoping and investigation to fully understand the potential cost and also the potential impact in terms of carbon. And those can be found at pages 24 to 26 and 31 to 32 of Appendix A. And then in order to give a full overview of the actions that we're already doing, we've also got an appendix to the action plan, which is business as usual. And it should be highlighted that given feedback that we've received at other panels, we've actually put a caveat against business as usual, because we accept we may need to adapt some of those services to be able to be more resilient to climate change. And then Appendix B is a very different version of the detailed action plan, and that is a web-based version. And the reason for that is that we wanted to consolidate the actions and give a very high level, easy read action plan that will go next to the strategy on the Sustainable Hertfordshire web pages. Of the 200 actions listed, we've actually identified 19 that we see as real priorities, because we need to undertake baseline work and investigations to be able to then help us to deliver the other actions that are identified in the plan. So we've duplicated those 19 enabling actions at pages 4 to 6. And then each action also has a lead portfolio. And the reason for that is because we want to be able to feed back to portfolios where the actions are relating to their area of concern and their area of work. But it has to be said that all of the actions will need collaboration from a number of different service areas to be able to deliver on those actions. So specifically relating to public health and prevention, in terms of quick wins, we are talking about just highlighting some of the actions there. Review of the health and wellbeing strategy. Bethan and I have already attended the Health and Wellbeing Board, and we are now working with colleagues in adult care services and children's services to start the review of the health and wellbeing strategy, so that can reflect the Sustainable Hertfordshire strategy and put in some public health elements in regards to climate change. We're also looking at developing a spatial planning informative so that we can respond to planning applications and also local plan consultations. And then again, this one is relating to locking in the opportunities that we've learned through COVID, working with adult care and with public health and other services to keep those positive behavioural changes. In terms of key works programmes, we are seeking to undertake climate risk assessments, and that's a very detailed area of work to make sure that our services are ready for future climates. So, for example, our services are ready for a flood event or a severe heat event. And also looking to review the delivery of a natural health strategy. And again, that's about looking at working in partnership with public health and colleagues in environment infrastructure to look at our own assets, as well as looking at other assets across the county in terms of open space and green infrastructure and how they contribute to the delivery of health and wellbeing. There are also a lot of actions in there that relate to air quality, and again, this will involve partnership working arrangements with public health and the need to work with our district and borough colleagues. We have now established the Hertfordshire Climate Change and Sustainability Partnership, and we want to make sure that air quality actions are taken through that particular process. We've got our own air quality strategy. We want to make sure that we're implementing that, undertaking audits if necessary at certain areas across the county, for example, near schools, and very much working in partnership with our district and borough councils to deliver the air quality agenda. In addition to specific actions that are relevant to public health and prevention, there are lots of other actions that will need collaboration and will have an impact on public health or will need input from public health in order to deliver. And there's just a few of those that I've highlighted there, looking at our carbon footprint, for example, across all of our assets, making sure that we can seek opportunities for heating, electrification, looking at our fleet, looking at how our staff work in terms of travel and paperless office, and looking at how we deal with managing waste, etc. And then also looking at education and awareness and communication strategies, including behavioural change campaigns. And then obviously commenting on planning applications where we are the planning authority and where the district and borough councils are the determining authority as well, and also local plan consultations. So I'll hand over now to Bethan, who's going to talk about clear links between public health prevention and the climate change agenda.
Hello everyone. It does occur to me that I think you've seen these slides before. Time flies when you're stuck at home having fun. Yeah, so obviously there's a huge link between public health and climate change and sustainability. You'll have all heard me say before that you can't have a sustainable community if it's not healthy, and that's pretty much the fundamental point around the collaborative work that we're really pushing forward with our sustainability colleagues at the moment. It buys into the public health priority moving forward around inequality, and a lot of the work Julie mentioned earlier around the natural environments that we're looking at, climate change risk assessments and vulnerable communities. It's very much focused on those communities who are living with inequalities at the moment, of all shapes and sizes, not just health inequalities. The health and wellbeing strategy is a huge opportunity to align strategic priorities, but it's also a way in which to give us the remit to actually go forth and do work, which we're doing now. We've got a number of questions which set out a framework for what we want to achieve, and we're going to build those goes into the strategy refresh in collaboration with colleagues from Adult Social Care. And this work is primarily around the scrutiny questions that we've been asked over towards the end of the summer. That came from the Centre for Public Scrutiny, which is around our understanding of vulnerable communities and how resilient our health and care services are. Needless to say, there's huge amounts to learn from COVID, and there's plenty of people who have used the phrase "it's a blueprint for the climate crisis" or "never let a good crisis go to waste." Not my words, but I think they're quite true. And I think there are there's some clear gaps and opportunities for us now to really capitalise on drawing the links between health and sustainability, and we're doing that. Not least with the natural environment work, which we're starting to look at, because that's not an area where traditionally we've had the justification to go forth and do a lot of work around that. I can speak on that more if necessary. The next slide, please. You've seen this before. It's recognised at a national level that climate change is a risk to health. Has been described as the greatest public threat of our time. There are a number of issues which are described as the greatest public health threat of our time, and this is one of them. Next slide. Yep, and just to reiterate, sustainable Hertfordshire requires a healthy population. So we need to really understand where we need to tackle our efforts around inequalities and resilience for vulnerable communities. Next slide. Oh, that's me done.
Yep, that's you, Dan. Thank you, Bethan. So in terms of the journey so far continued, this is the 7th panel that the action plan has been presented to, focusing on specifics relating to each portfolio as we've been presenting, with a view to taking the finalised version of the action plans to Cabinet and County Council on the 14th and 15th of December. It's fair to say that we've had a really good level of response through the Cabinet panel process, and where I've been able to take on board the comments that people have already made, I have already changed the action plan to reflect that. So the version that's actually been published as part of the Cabinet agenda has taken on board the comments received so far through the panel processes, and then a verbal update will be given to County Council on the feedback in terms of this panel and tomorrow's panel, which is Education, Lobbies and Localism. So we have been trying to update it as we've been progressing through each of the panels. In terms of recommendations, I'll leave it to the chair to go back over these at the end, but very briefly, it's about noting the content as business as usual, which is the appendix to the action plan, and then agreeing each separate section. There are quite a few recommendations that are fairly detailed, so I'll leave that to the chair to go through after questions and debate. Thank you very much.
Thank you, Julie. Thank you, Bethan. So I'm going to go straight into questions, I think. So we do that first. Ron.
Thank you, Chair. I'd like to talk to page 155 of the agenda pack, which is the last item on clean air, which is our responsibility. Can I first ask if someone could actually spell out what the spatial planning informative note is, what it covers? And I would like to hopefully be assured that as this is about air quality, that this note will cover how this county is going to expand its charging points and build the infrastructure so that we can be prepared for the electric vehicles that are coming fast down the road after the government has moved the goalposts, as it were. So it's part explanation and part have we got electric vehicles firmly in our sights to actually assist us in helping the air quality issue.
Yeah, okay. I can explain in terms of what's the spatial element of it with relating to planning, and then Bethan will come in terms of the air quality details, and I can talk about the EV charging strategy as well. In terms of spatial planning, County Council, as you know, is a planning authority in itself in terms of minerals and waste, and then we have the 10 district and borough planning authorities as well, predominantly dealing with the built environment. And the spatial planning informative relates to the title that we've given ourselves in terms of planning authority. We're called spatial planning. So it's literally an informative to be able to respond to planning applications that we are consulted on and also planning applications where we are the determining authority, and it will cover issues that we wish to see within those planning applications once they're being dealt with relating to air quality. And I also think that that particular informative document could then also reflect on what may need to be required through local plan policy processes, but I'll let Bethan give some more details on the content of that. Just on the EV strategy point, there is a Hertfordshire County Council specific piece of work that's being drawn up now and to be presented to members in the new year, specifically relating to a county-wide EV strategy. My colleagues in Transport and Highways are working on that at the moment, with a view to providing a really comprehensive strategic network of EV charging points across the whole of the authority area. And that will involve key partners, including district and borough councils and also private developers as they bring forward new developments. So Bethan, do you want to provide some more detail in terms of the content?
Yes, I mean, basically the air quality informative note is a very specific action which was agreed as part of the air quality strategy and implementation plan back in 2018, I think. Gosh, that feels like a long time ago. And that is a very specific piece of work, which is a document which sets out our position on air quality as the county council. That will then feed in and be submitted as part of any response to planning. And it's there to inform local planning authorities, so the district and boroughs in their policy making, and also the development management when they're approving or not planning applications. But it's also there to inform developers of what we expect. It's largely as a get around, because I don't think we're in a position, or we're not able to develop a supplementary planning document for various reasons, which I probably am not expert enough to explain. So the informative is solely there to set out why air quality is important in planning terms, what can be done in planning terms to address it, and what we would be seeking from development proposals in that respect. And it would be used to support any conditions of planning that we might seek from a planning application. It's been a long time in the making. We actually have, I'm in the process of reviewing it, because the Gilston and Harlow Garden Town work, which is the very large development in and around East Herts and Harlow, has developed its own guidance on air quality, which I'm going to plagiarise, basically, with their permission, obviously, because it's top notch, it's gold standard stuff, and the more consistency we can have with major developments going across the county, the better. So it's in preparation at the moment.
Thank you very much, both of you. Can I just ask, with Tim's indulgence, I fully approve of plagiarism, because why invent the wheel again? You know, certainly go for the best. Yeah. But secondly, have you got any timescale on when this will be sent out? When this will become a standard response from the county to the districts, so that district planning committees will then have to take note of this? Because obviously the earlier we can get it in place, the earlier we can start to impact on air quality. Yeah.
So to be clear, air quality is a standard part of all of the public health responses to local plan policies and planning applications, and has been for a number of years now. Because of some of the experiences we've had in challenging on air quality, it was felt that we needed this informative just to set the scene and be consistent, so that actually it's not just us who uses it. It could be our Transport and Highways colleagues who use this as well. So from a timeline perspective, we can get this done quite quickly. Whether or not it will need to go through panel to be approved, I will need to explore, and I would think it probably would. But there, it's just to kind of like reassure you, we are already lobbying our planning colleagues at the district and borough level on air quality all the time, and get somewhere in some cases, but have difficulties in others. So it's not that there's a gap, it's more that we're reaffirming and putting into a specific document what we're already doing.
Thank you very much. It's a very comprehensive answer, and well done, and keep going.
Thanks.
Thank you, Ron. I think it's worth reminding everybody that Bethan has been very proactive in these areas. I mean, we did agree a strategy, I think, probably back in 2018 now, I can't remember which way around it goes, where we would, as a public health department, make comment on certain size planning applications, whether or not we were invited to do so. And I've made it very clear that I think government, in its putting together planning rules, should put something in about requiring a public health comment on all planning applications of a certain size. So we are being proactive on that and will continue to be so. Fiona, you were next, I think.
Thank you, Chairman. This is also on air quality. Yes, the aim is to have clean air for all by 2030. So what progress is there with the anti-idling campaigns outside schools and HWRCs to help achieve this?
In terms of the action that's identified with specifically in here, relating to household waste recycling centres, which are now called recycling centres, we haven't started that campaign in earnest because of COVID. We had a situation whereby the HWRCs were shut for a long period of time. We have already introduced all the cameras at the HWRCs, and that has really improved queuing, because people can look at the live cameras and see when it's best to go. We're hoping that we can now start looking at that in a lot more detail in terms of putting signage up at the HWRCs, because the signs could be on our own land or on land that we rent to deliver that service. It's a lot easier to do that rather than putting on signs on the highway. There are issues with putting anti-idling signs on the highway, but we can now look to do that through our colleagues in waste management. So I would say that that area of work is progressing, but it has been hampered by COVID and the restrictions that were placed at HWRCs now that they are open again. And also the complication, or hopefully not a complication, but actually an opportunity, that the HWRCs have been brought back in-house. So they are now Hertfordshire County Council run and operated, so that we have a lot more say and can hopefully encourage the staff there as well to be a lot more proactive about asking people to turn their engines off. So I think the HWRC situation is in a better position than some of the schools. I know that some schools have found it difficult to put signage up because of the highway regulations, and other schools have been very, very proactive and have put their own signs up where they are on their own land. Certainly at my children's schools there are signs up about anti-idling. I don't know if you want to say anything about anti-idling, Bethan.
Well, we've been having periodic annual campaigns with schools around active travel, green transport, anti-idling for years now, with our Sustainable Journeys to School team, or they've gone through various different team names. And over the last 2 years, we've also been part of the county-wide effort around Clean Air Day, which this year was delayed until October. Prior to the pandemic, we were working with our behavioural psychology team and our school travel plan team around getting behavioural insights into anti-idling campaigns to try and sustain their impact, because at the end of the day, they're time limited normally, and the impact they have is also time limited, and you don't find that there's sustained behavioural change as a result. That work has also been delayed because our behavioural psychology team have been pulled off into doing all of the things around social distancing in town centres and so on. However, we have had conversations with the Safer Travel to School team. They are looking at doing pilots now around anti-idling and active travel schemes in specific areas, which they're working through the project scope now. It's very challenging to do these kind of behavioural change schemes. I don't think we can have any doubt about that, particularly when the dominant mode of transport to schools is cars. But we are constantly looking at it, and we're doing that in collaboration, and it works in some areas better than others.
Thank you.
Thank you, Bethan. I think it's important that I think we all know that the pressures that COVID has brought on all our activities. I think it's important to make sure that we don't blame it for everything. I think we, if we can put it that way, I think we've got to move some of those things forward. And I think publicity around, for example, hiding outside schools probably needs to be emphasised and reinforced, because it's quite should be quite a quick win. There we go. I've got a number of people lining up, and I'm going to politely remind you of the time. So I'm going to invite you to be as concise as you could in your questions and answers, please. Nigel is next.
Thanks, Tim, and I'll be addressing my questions to Julie. So a couple of things from the thing I picked up on. You talked about baseline assessments at one point in your discussion. I see from somewhere in the reports that we did have a baseline assessment back in 2012, 2013. So my question on that is, what's happened since, and why have we not been keeping up with that? And why are we having to do things again? The partnership that's been set up across the county with district colleagues, do we have county council members involved in that, and who does it report to? Who's in overall charge of this? Is it you, or is it and are we sufficiently, is it getting a sufficiently high priority at cabinet, as you know, in terms of, you know, is it being divvied up amongst portfolios, or have we got sufficient priority? And have we got, well, I haven't seen anywhere in the documents, and by the way, sorry, the Appendix B, I hadn't realised the purpose of that until you introduced that today. That's really helpful. I think it's a much better approach. The first few pages of that, I think, should be in the strategy document itself, because it sets out much more clearly what the aims are than anything in the strategy, to be perfectly honest. But what's still missing, as far as I can see, is any estimate of what impact each of those actions will have, and how we get to net zero in our own operations, at least by 2030. That's all from me.
A lot more than a couple of questions in there, I think, but
okay, I'll try and be quick, Tim. Yes, in terms of baseline assessments, yes, you're right, they are out of date. The reason they haven't been updated on an annual basis is simply because of resources. We didn't have a specific person or a specific team who was looking at this particular agenda. We used to have, but we didn't in that particular time period that you're talking about. But we do now have a Sustainable Hertfordshire team in place, which is myself and one and 2/5 other, with the hope that we can continue our team and grow our team to be able to deliver on all of this work that we're doing right now. So we actually, the updating of that baseline work is an essential for us, and we've been in discussions this week and last week with our consultants WSP about updating that particular piece of work as a matter of urgency, and also doing the climate risk assessment work as well. So we are trying to plug those gaps, and it's safe to say that the Committee on Climate Change has been producing more up-to-date information, and it is a very quickly moving feast. They've reported the 6th carbon budget this morning, actually, and saying that we need to do a lot better to be able to meet the 2050 deadline, for example. So, you know, we're getting information out all of the time. HCCSP, Terry Heritage sits on HCCSP in terms of Hertfordshire County Council, as does Mark Kemp at a senior officer level, and I'm the chair of the Hertfordshire Sustainability Officers Group, which is the working arm of HCCSP. In terms of is this a priority and are we getting sufficient resources, I'll leave Tim to answer that in terms from a cabinet point of view, but from my personal point of view, I have requested through the due processes that we do focus our efforts on this particular area of work over the coming years, and I think it's a great step that we have a specific team now who have been given this job, and I am very much in in high demand, shall I say, from all areas, including going to every single panel briefing and cabinet panel relating to this particular item. But I'll let Tim come back on the cabinet issue. In terms of the impacts of the actions, you're absolutely right to raise that as a question. We have got some estimates in terms of their impact where they were tangible, and WSP have highlighted that in terms of the red, amber and green, but they are very much an estimate based on what we could achieve if we were to do certain things based on the information that they had at the time. It was a very, very quick turnaround to deliver this action plan from March to June, effectively. And so that's again why we've got the need to go back and look at some of those areas in a lot more detail, because we need to fully understand the cost and also the carbon impact. We've also engaged with the LGA, who are very keen to work in partnership with us to really go down into the minutiae of a trajectory for how we get to 2030. So again, there's still work to do on that to be able to identify it.
Yeah, and from a cabinet perspective, I can assure you that there's total commitment to this. In terms of resources, there's an active discussion going on at the moment as part of the IP process as to what resources we can put into it. But I can be quite clear and unequivocal in the wish to get this sorted and get it moving forward. So there will be more news in due course, I think, as far as that's concerned.
Thank you both.
Thank you, Nigel. William.
Thank you, Chair. I have one area of concern which I'd like to ask about, and that is the source of the statistics used in assessing our carbon footprint. For example, does it include the cost of extracting the lithium that's used in the manufacture of a mobile phone, which is then imported and provided to staff, or do we discount the carbon costs of imported goods?
Yeah, another very, very good question, and that relates to what's called Scope 1, Scope 2 and Scope 3 in terms of our carbon emissions and looking at our supply chain. And there are specific actions relating to procurement and supply chain in the action plan, because we recognise that it isn't just our physical actions, it's about what we buy, and we have a very large purchasing power. And so we do need to be considering the supply chain in terms of what we are purchasing. So we've got a specific action in there around looking at our procurement strategy and having a more sustainable procurement strategy, and looking at potentially putting in criteria that will be used to evaluate a tender, for example, when it comes into us. But we also want to look at the supply chain as well. So it's about every decision that we make, and so that we're looking at the carbon impact of the supply chain as well as all of our actions that are attributable to us. So we are clear, we're more clear about our Scope 1 emissions than we are about Scope 2 and Scope 3. We're working very closely with Hertfordshire Climate Change and Sustainability Partnership to fully understand Scope 2 and Scope 3. It is extremely difficult to fully understand Scope 3. And I hope that members will appreciate that we are trying to do that. And I think that lots of other people are struggling with Scope 3, and we are seeking guidance from local partnerships who work through the LGA to look at a county-wide, it's called a scatter, which is a county-wide emissions calculator, and that would very much help us to determine Scope 1, Scope 2 and Scope 3 in a lot more detail than we have been able to so far.
Thank you.
Sorry, Tim. You're on mute. My lip reading's not that good.
Some people would say that's the best way for me to be. I've got 3 hands left up, and I'm going to draw a line after those 3 hands. So we've got Margaret, Annie and Anthony. Margaret.
Thanks, Chair. 3 questions quickly. One is about cycling, that you haven't specifically mentioned how we are helping people to cycle more. And to be, there are 2 things I was going to say. We could learn from Waltham Forest. I used to be head of public health intelligence in Waltham Forest. They've done really well in setting up second-hand bikes shops and training in maintenance for school leavers, and us really genuinely trying to help people who might not be able to afford a bike get a bike, and also our safe cycle paths right across Hertfordshire. I actually would like to ask if we could scrutinise the active travel fund, because some of the cycle paths I feel are more of a tick box than genuinely joining up cycle paths so that everybody could get from A to B on a bicycle instead of using a car. So that's a little request. Somebody mentioned the Bethan, the Gilderston and Harlow sustainability plan. I managed to miss the webinar. I really wanted to see that sustainability webinar, and I wondered if you could just tell us on an email how to see a report on that. I'm interested in sort of their gold standard for air quality, because I have a big issue about air quality, particularly to do with spatial planning, that they appear to put monitors in after the horse has bolted. And it's really quite tricky that the people who have the air monitors are in the local authorities, but how do they decide without any data where to really put them? And they tend to put them where people shout the loudest, when actually I think public health, we need to work as a county council on the guidelines for where they are meant to be putting these air monitors in. For instance, you've mentioned idling. It would be very good to put a monitor to see the health impact and whether we can do before and after a strategy that is trying to get cars to not idle outside schools, park 500 yards away from schools, you know, trying to actually curb our PM 2.5 diesel fumes. And it's happening in places where, for instance, there is no lay-by for a bus, and a bus stops on a single track road and 50 cars queue up when the bus stops at the bus stop in rush hour because they actually can't overtake the bus. And that is also a place to put in air quality monitoring, but it doesn't appear to be happening. And that there's this sort of chicken and egg situation where it doesn't become a Department of Environment quality monitoring point until they've actually got data for a year showing it's bad. And I would really like more joined up work on how to decide on guidelines as we gradually get more air quality data to really identify where we should be putting in air quality monitors, if possible, before a planning application is accepted. Because frankly, once they've built whatever they're going to build, it's a bit late. It's very difficult to change it afterwards. But actually, if they should never really be building because of air quality issues, we haven't always got the data. I realise they can't put monitors everywhere, but I do think we should work on a better strategy for where we should be having particularly PM 2.5 monitors, but nitrous oxide as well. And they are getting cheaper, and I think there are combined air monitors that are more available. And can we have some in the county council as well as in the local authority? Sorry, that was rather a lot. Was there something else? No, that'll do. That'll do for the moment. But particularly spatial planning, I feel that we should be really putting air quality in before the DCC, before any permission is given, rather than afterwards.
A point well made, I think. Julie,
just quickly. Yes, thank you, Tim. But very quickly, before Bethan's going to answer the majority of that, just very quickly to say there are specific actions relating to cycling in the action plan, and it's very much a combined approach whereby we will need behavioural change campaigns, we will need to support people in terms of the bikeability work that we do, and we'll also need to make sure that we do have sufficient infrastructure for people to be able to make the choice to be able to use their bike. But Bethan's going to answer on the other issues that you raised.
Oh, I just one other thing. I've had a letter from Gripe saying that they're not supporting electric buses, and I just thought
you're on mute, Margaret.
Yeah.
Somehow.
Margaret, you're on mute.
Bethan, I think.
it's about electric, but I had an email from Gripe about electric buses saying that they were not supporting electric buses as a policy in Hertfordshire County Council. And you've just mentioned that you are producing a sort of new strategy for January on electric vehicles and charging points. I was really quite taken aback by what they said, because
I think, Margaret, if I can interject, I think you need to take that back to Gripe, but
I will forward you
my understanding is that they're not against electric buses per se. I think it's probably a comment about the cost initially and the need to engage the bus companies. So I think that's there's a bit more behind that perhaps. But Bethan, if you can take on the essential points.
I'll try. It's quite a lot. So just picking up on the Emergency Active Travel Fund, Margaret, I was linked into that with highways and transport colleagues throughout COVID. I think if you have any specific questions around those schemes and what that money is being spent on, I'm happy to raise it, because I attend their forums, and we can take that offline. So and Julie's answered the other things around cycling. In terms of the Harlow and Gilston Garden Town webinar, I will see if I can find a link to see if it's available somewhere. It was very interesting. I can't quite remember. There's been quite a lot of webinars I've attended recently, but I will try and dig that out. In terms of air quality, the gold standard air quality guidance is part of the Harlow and Gilston Garden Town Sustainability Design Guide, which is out for consultation at the moment, and all members should have been alerted to this by our growth and infrastructure colleagues, Matt Wood. That's online. I'm happy to send out the link to that as well. And in terms of how do monitors get in place, well, there's a very long answer to that, so I'll try and be quite succinct about this. We can ask, and we do. And as you're well aware, we negotiated terms of planning, conditions of planning for Bengio, for example, for the quarry, to get monitors in place before, should that permission be granted. That requires the developer to engage with us and the local planning authority to take it seriously. And I suppose my point is, from a statutory perspective, it's environmental health who need to be asking for these things, and they do. And we will support them in that, and we liaise when we're responding to planning applications. If air quality is a concern, we will liaise with the appropriate environmental health officer at the district. And they are very under-resourced. It's very hard to get that work done. That it requires the planning authority to agree with us that it is a concern, and to force it through with developers by way of condition should planning permission be granted. And it also requires very early engagement so that you can get those monitors in place before they commence on site. So there's a lot of issues and challenges for us, public health, in ensuring that we're engaged at such an early stage that we can flag this as a going concern. So it's not perfect. We're well aware of it, but please be assured that we do ask for early monitoring. We have no statutory teeth as a public health department. We're not even a statutory consultee, so we have to influence where we can and not upset too many people to the point where we have no influence at all. So, and in terms of HCC monitors, we have looked at that previously. The issue there is, well, we do have monitoring. Highways use it on some of their schemes. We don't routinely deploy our own monitors because that's a resource issue, because someone needs to have the skills and expertise to then monitor and interpret it. But highways will do monitoring as part of their schemes, and they're looking at it from a digital technology perspective now about some of the big schemes they're doing from a highways perspective, where they can employ monitoring from the outset and how that would be calibrated with the standards that DEFRA require for the reporting network across Hertfordshire.
Thank you.
I will write to you, Bethan, about this.
Okay.
Right. I mean, I was listening to the debate. I'm not sure how you can put a monitor in to see what the impact of something that hasn't already been built is, but
it's to get the baseline.
Will deal with that.
Yeah, Tim, it's to get the baseline, so you know what the background levels are, okay. And then when development commences, you can see whether development is having an impact or not.
Right. Okay.
It could be already breaching WHO standards.
Okay. Fine. hands up, surrender. Annie.
Yes, thank you, Tim. Just very quickly, Bethan, I'm absolutely delighted as a sort of pincer movement, you're taking public health view into our cycle routes. So thank you very much for that. And I think members know that the last tranche to active travel funding very much was used in urban locations and hasn't always been that successful. And we've been campaigning with the Transport Minister, Chris Heaton-Harris, who says that actually we should be able to use the money where we feel fit, and that's what Hertfordshire wants to do. And we've got a local group that's looking at the cycle routes that we need that aren't usually in existing road space because our roads aren't wide enough. So it's often adjacent to or even cross country. And the more ready schemes we've got, they're then ready to actually implement when we've got funding. But I'm really pleased that we've got a big voice from public health in that because it's very obvious. The other quick thing is when I was in Putney, I saw some really attractive signs on lampposts about the size of the neighbourhood watch type ones. And I'll send them to you. And these are anti-idling outside schools. And I rang them. I rang Wandsworth Borough Council, and they'd found a way round the highway issue for these signs. So I've got an article here, and shall I email it to you?
Yes, I can definitely find the right person to send it on to.
Yeah. Okay. Thank you.
Thank you, Annie. Right, finally going to Anthony. I hope your audio's a little bit better now, Anthony.
Well, just gesticulate if it isn't. I shall be very brief. Annie has just alluded to what I wanted to ask, which is born of experience helping a local primary school. About 2 years ago, it was thwarted by Department for Transport not being very supportive, in fact, being wholly unsupportive. So I'm just really wondering from Bethan, but also listening to what Annie has just said, as to whether actually the vibes from Whitehall are now more supportive.
Can I clarify in supportive in terms of anti-idling outside of schools or something different?
And anti-idling signs both outside the school, but also if the school wishes to put up its own signs.
Oh, right. To be honest, I don't know the answer to that. I don't know if Julie does. I can certainly ask, though.
Yeah, I think we need to go back to highways and ask them, because I would like to hope that given given the wish to secure some of the positive behaviours that we've seen through COVID, that they'd be a lot more supportive in all of our efforts in terms of active travel and the switch to EV charging points, for example, and electric vehicles. So I would like to hope that they were a lot more supportive, and I'm very interested to see the example that Annie talked about, and we can certainly take that back to our colleagues in highways. I'll need to get an answer from highways as to how supportive or not the DFT with regard to that signage.
Julie, if I make a general point,
yep.
I think if there is legislation in place which isn't helpful,
we should be lobbying.
Which ought to be trumped by common sense.
Yeah. I
think it's incumbent upon us, whether it's a cabinet member for public health, the leader, or whoever, to write to whichever department and make the point. So I think that's something, if you were to take on board.
Yep.
I will certainly mention it when the cabinet meets, because I think it's a fair point. I mean, I was very tempted to suggest we go around fly tipping, but I better not do that. I'll get into trouble. But it does seem a bit bonkers if we're not allowed to put up a sign outside schools warning people of the damage that they might be doing to their own children. So, point well made, Anthony and Annie, and let's see what we can do about it.
Yes, thank you. Just very briefly on that, there is also an issue about enforcement and where enforcement lies. So, for example, you can charge people, you can fine people for idling, but it sits very squarely within certain aspects of council duties and council responsibilities, and whether or not they do want to take that on board in terms of responsibility. So it's not necessarily just the signage, it is about the enforcement of that signage as well.
Yeah.
But yeah, absolutely take your point.
I think at the end of the day, I mean, we hope that most people will be sensible. experience will tell us that some people won't be, but I think at least initially, if we can appeal to those people who are sensible and responsible, then maybe we'll have some impact, but we'll see how that goes. Look, I think we've had a really good debate on this, so I want to thank Julie and Bethan for their input. It's a debate which is going to come back and roll on for a long time until we actually crack all this. But nonetheless, I think there's a real will to do something about it. So all power to your elbow. We've got 7 recommendations before us, and subject to anybody raising a hand in objection, I pause for a second. I'm going to take all 7 and vote as one. I'm not seeing any movement of any hands coming up objecting to that. So on that basis, can we take all 7 recommendations as one and vote either for, against or abstain? Thank you. I'm going to come in late as a 4. No, I'm not. I can't get mine to work. Looking at that, Stephanie, you all agreed? We're unanimous? Grand. Thank you. I think there's a lot of comments to take away, Julie and Bethan, but we support it. And as I say, hope that you can move this forward as quickly and as rapidly as possible. Right, thank you.
Thank you very much.
Thank you.
The final item on the agenda is the future work programme, which which we're not required to vote on. We're invited to note the future work programme. Again, I think some important items on that programme. If anybody wants to discuss with me anything else that should be added to it, please let me know. Nigel, you got a hand up there.
Yeah, thanks, Chair. It was actually on the recommendations. Just if you could please note in the minutes that whilst we agree these recommendations, we do think more could be done quicker, particularly in terms of committing funds. But we'll obviously bring that up at council next week, I'm sure. On the work programme going forward, is air quality coming back again anytime soon to this panel as a separate item, or are we leaving it as part of what we've just discussed?
I certainly haven't considered that yet, but I think it's a fair question, and I'll speak to officers about it to see what they think. Personally, I think it's all part and parcel, but there we are.
Yeah, I mean, when it came up 2 years ago, I think, or whenever it was, I think it was the end of 2018, wasn't it? I think we went through this. Yeah. I mean, I think we felt then that we'd now got everything in place to see it moving forward, and I think we were promised that we was going to come back to panel within a reasonable time to see how much progress had been made. So yeah, leave it with you.
I'll have a look at that. I suspect if we were to measure it after the past few months, we'd probably get a false reading anyway. So but I take on board your comment. So I think it leaves me with no more to do but to thank all the officers for their input, and in doing so, it's been my practice to write to all the public health team about this time of year and thank them, and I'll do that separately. But I think it's only right that in public to thank Jim and all his team for the amazing work that they've done over the last 12 months, and not just on COVID, but I think maintaining an awful lot of business as usual activity. And so, Jim, if you could pass on my thanks, and I'm sure the thanks of the panel to all the team, it's very much appreciated. Thank you.
I'd be delighted. Thank you. Thank you very much.
And thank you, panel. I think it's been a good debate. We've slightly overrun, but I think it's some important stuff being dealt with this morning. So thank you, one and all. Cheers. Thank you, Stephanie.